organisms, pathogens now, how do they get into your body? How do they start infection? In other words, how do they get into you to start growing in the first place? Let's talk about portals of entry. How do they get in? Well, there are four major pathways, okay? Your skin, your mucous membranes, I call mucous membranes your inside skin. So the mucous membranes, they basically line all of your cavities that lead out to the environment. I call it the inside skin, okay? The placenta, and then parenterial root. We'll talk about all of them in detail. Now, this one is showing you different routes through the skin or different entries. Of course, ear goes into your body, the conjunctiva of the eye. Now, the conjunctiva is basically the mucous membrane of the eye. Over the actual eyeball and the inside of your eyelid, that membrane is called the conjunctiva. All right? That's why you shouldn't put your hands in your eyes. That's how you get viruses that way. Okay? Of course, through your nose, through your mouth. Ooh, we got bites and broken skin. That's not good. Through the anus, urethra, and males, basically urethra, the penis, women, the vagina. In terms of this poor infant, this baby here, through the placenta from the mommy. Okey doke. Now, the main purpose of the skin, basically the skin is the largest organ of the body, by the way. Okay? That skin keeps things out as long as it's what? As it's intact, right? It keeps pathogens away from the inside of you. Now, of course, your epidermis, right? The epidermis, this stuff here is already dead, right? It's already dead. That acts as the barrier for pathogens. Now, some pathogens are keen. They find ways around your epidermis. They're sneaky. They find openings, right, in the epidermis, like your sweat gland, right? That's an opening, correct? Maybe the hair follicle. That's an opening. They're sneaky like that. You don't need a cut always to get sick. They kind of just find a little entry through the epidermis. Now, others, like some worms, for example, some worms will actually digest their way into the skin. Some fungal infection, for example, they digest their way through the epidermis. So, ladies, if you ever gotten your nails done, right, and you weren't properly caring for those manicured nails, by the way, okay, you end up getting green nails. Okay, that green you see, that's a fungal infection. So the fungus kind of got under the nail itself. It just kind of got under there. Yucky stuff. Now I mentioned, okay, how can pathogens get through the skin? The skin is intact for the most part, but they can find their way through a sweat gland. Okay, that sweat gland is opening out here, but it goes way down in the dermis, right? Way down in here. It's basically in your tissues. But what about the hair follicle, right? There's the hair. And there is what? The hair follicle. That's another way to get into the tissue, right? You bypass the epidermis. You even bypass the dermis, right? So at this level, you're basically in the tissue itself. You're basically almost into the body, makes sense? So pathogens can use those two routes of entry to bypass the skin as long as it's what? Intact. Okay, your inside skin, your mucous membrane that I mentioned earlier, it basically lines any body cavity that opens to the outside world. So basically start with your mouth and with the anus. All of that is lined with what? Mucous membranes, as well as your eyeball and the inside of your eyelid, mucous membrane. Now, the main difference between your outside skin, okay, epidermis, and the inside skin, mucous membrane, the main difference is this, okay? Mucous membranes are moist, right? Isn't your mouth moist? Moist. Is your mouth warm? Warm, okay? Also, it is thinner. That's not up there. So the mucous membrane, in comparison to the epidermis layer, it's thinner. So it allows easier access for pathogens into the body itself. It's easier to get through. Now, the respiratory tract, for example, is the most common site of entry. So basically you breathe in dust, right, with bacteria on it, air droplets, bacteria on it, okay? You got a cold, for example, or some other infection. Now, we know about the nose and mouth, you breathe it in through those eyes. Now, I mentioned before, it's not a good idea to touch your eyes with your hands, right? Because this is how you get influenza virus or the cold virus. You basically touch surfaces, right? Okay? And then you rub your eye, okay? You just put that virus onto that conjunctiva. It's basically a mucous membrane, it's thin, okay? The viruses get washed into the nasal duct with your tears, And that's how they infect what? Your upper respiratory tract. As far as so good. So try to avoid, if possible, it's easy for me because I got glasses, right? So I really can't get to my eye. But if you don't wear glasses, right, try to avoid doing that. Because that's how you introduce colds and influenza into your body. They get in through your eye. Now, let's talk about the gastrointestinal tract. That could be a route of entry. Keep in mind, anything being a pathogen coming into the gastrointestinal tract, it has to be able to do what? Withstand the pH of the stomach in order to colonize you. Make sense? Sure, you can get foodborne infections, right? Sure, you can eat certain foods with bacteria through your stomach and they end up in your colon and give you diarrhea. But in order to colonize you, they just have to withstand the pH of your stomach. Okay, now what is this placenta? What is it? What is placenta? Okay. So the placenta is an organ, it's an actual organ that the baby actually makes. And it's basically the connection between the baby and the mom. Now that placenta is actually kind of thin. And it's thin to allow exchanges between mom and baby. This is how baby gets rid of waste, right? This is how mommy gives nutrients to baby. It's called the placenta. So this is an organ that's actually made by the growing embryo. Okay, now, typically, this placenta forms a good barrier against pathogens, but some pathogens are very keen, and they actually cross the placenta. In other words, the mom has some pathogen. It comes from the mom, right? The mom has some pathogen. That pathogen actually crosses the placenta. And that happens, okay, that embryo, that fetus, will get the infection. And depending on what the pathogen is, it can have some bad results, like abortion, for example. Basically, a miscarriage, depending on what the pathogen is. Okay? So basically, spontaneous abortion, that's basically a miscarriage, birth defects, or premature birth. Of course, birth defects can be things like deafness and blindness. Okay? Real quick, just a couple of ones. Okay. This protozoan is Toxoplasma gondii. Causes toxoplasmosis. Look at what it can do to that embryo or fetus. Now, this is why it is told to pregnant women that if they have cats, for example, they should not change the kitty litter. Because this protozoan, it can be in cats, for example. So the cat can be the reservoir in this case. And it comes out in the cat's feces into the kitty litter. Now, if you're a normal individual, you're fine. Okay, you're fine. But if you're pregnant and you're changing kitty litter contaminated with toxoplasma, well, the fetus or embryo can get toxoplasmosis, and you can see all the bad things that can happen with that. So keep that in mind if you do have a kitty cat and you end up getting pregnant. Now, let's see. In terms of viruses, for example, okay, cytomegaloviruses, these are basically your herpes viruses. Okay, they're your herpes viruses. They can cause placenta, can cause deafness or mental retardation. They can cause blindness, for example. So if the mother has a herpes infection while giving birth and the infant comes through, it can cause blindness. Just like if the mother had a gonorrhea infection and the infant comes through, it can also cause blindness. And the other one we should mention, we already know about HIV, right? This is why moms should get tested early, because as long as the mom takes medications while she is pregnant, it is shown that she can stop the spread of HIV to her baby. It's shown that that's proven.
But even without medication, how come some babies are born negative?
HIV doesn't always cause placenta. So all these guys up here, it's not saying they always cause placenta. It means they can. Because there's lots of people with herpes infections, for example, but their babies are born fine. So in small percentages, these babies can be exposed to these diseases while still in the womb. If so, they can have some pretty bad effects. Okay, this parenterial route. This basically means you are bypassing the skin. In other words, the skin is usually intact. Okay? But this word means you are, bless you, you're bypassing the skin. In other words, let's say you got some vaccine, and usually when you get a shot, they normally sanitize or clean your skin before they put the needle through. You know why they do that? There's lots of bacteria in your skin, like Staph aureus, for example. And if given the chance, if Staph aureus gets into your skin with that needle, you'll get an infection that way. or even a puncture wound, like stepping on a nail, for example, stepping on a staple, anything like that. You are bypassing the skin, correct? Even insect bites, right? Anything that punctures the skin to allow some organisms to get through, that's the parenterial root, makes sense? The skin has to be punctured in some way. Insect bite, a needle, or you just stepped on something, got it? Now, when this happens, these pathogens are deposited directly into the tissues, right? Underneath the skin or right into the mucous membranes. And you best believe you'll get sick, right? You will end up with some kind of disease because they get into the tissues itself.
That's how they do some flu vaccines now. It's nasal, they just squirt it right up.
Yeah, now with that one, usually when you get the nasal shot of the flu vaccine, that one is more prone to get you sick versus the one that you get in the arm. So you usually, adults would get, healthy adults, not old people, okay? But healthy adults, they can get it in the nose because you're more likely to get sick with the flu. Usually kids, pregnant women, nope, you get it in your arm. It's more safe that way. Okay, now this part is key. How can a pathogen cause infection, like take a root and eventually make you sick? The first thing it has to do is what? Adhere to your cells, right? It has to have time to actually attach, right? Adhere means what? Attach to your cells. Without that, guess what? They can't take a root, right? They can't form a colony. They can't make you sick. Now this concept of adhesion, this is important to what? Establish a colony within the host. Now, to do this, they use something called adhesion factors. Now these adhesion factors, they can be specialized structures, like, I don't know, fimbriae. Haven't we talked about fimbriae in some chapter? Basically like pili, okay? Yeah, these things are actually attachment guides. They can be used to attach to your cells. This is how E. coli, for example, makes its way up the urethra into the bladder with those fimbriae. They're just doing that. They're rock climbing up there, all right? Or actual attachment proteins, okay? Specialized structures can even include with the worms, for example. If you're going to take that lab practical next week, things like hooks and suckers, those things are used for what? Attachment. Think of that lovely tapeworm, right? It's using those hooks to attach to your intestine to make sure it doesn't get excreted out, essentially. You're hanging on for dear life, eating all your food. Okay, no. Now, over here is a real picture. This is a transmission under a microscope. All these guys here, that's E. coli. And that's E. coli hanging out near the mucous membrane of your intestines. And in this case, that's okay, right? That's all right. It's supposed to be there, correct? Now, this dark stuff you see here, all that dark stuff, that's basically the glycocalyx, basically that sugar coat around it, that helps it to stick onto the epithelial cells in the mucous membrane. Now, what you can't see is the cartoon version. Now, on the outside of the microbe, it's going to get real technical, but I'll keep it real simple, right? On the outside of this microbe, we've got little proteins called a ligand. Now, these ligands look to hold on to something. And what are they looking to hold on to? Okay. They are looking to hold on to some receptor on your cell. So in order for a bacterium, for example, to actually attach to your cell, it has to literally bind onto it. How does it do that? It uses a ligand. They don't ligand like a little hand. It has to grab onto something, right, to attach. What are these ligands looking for? Some receptor molecule on your cell. Now, why is this important? If you take away their ligands, in other words, if you take away their hands, can they attach to your cells? No, they can't, which means they can't make you sick. Make sense? This is why this is important. And usually, this interaction between the little hands here, the ligands, and the receptors, usually is very specific. That's why, for example, certain bacteria only colonize certain parts of your body, makes sense. If you talk about STDs, right, like gonorrhea, so Neisseria gonorrhea, do you find it in your eye? You could, but usually it's where? Down there somewhere, right? Why? Because their hands, right, their ligands are tailor-made for the urogenital tract, makes sense? Not the respiratory tract, right? The urogenital tract. That's why these guys are really important. They can be very specific to what cells they actually bind onto. Okay, this looks scary. Let's go this real quick. The thing's like, I don't know about this one. Okay. Now, attachment proteins, like the hand I was telling you about, okay, those ligands, the attachment proteins just help in adhesion. They're found in both viruses and in many bacteria. Now, let's see. Viral or bacterial ligands are basically hands, right? Think of ligand as a hand. What are they holding on to? Receptors on the cell. Think of my little picture, right? Hands are looking for receptors, either on viral or bacterial. Those ligands are looking for something to grab onto. Now, this interaction helps determine the host of specificity. I gave you an example, right? Neisseria gonorrhea, urogenital infections, because those hands are tailored for the urogenital tract, not the respiratory tract. So it holds in the specificity of that organism to the host. Now, we just mentioned this before. If you change the hands, right, or even take the hands away, guess what? You prevent colonization, correct? That's a cool thing to do. Now, the inability to make, now, I'm going to point this out. When you see this word attachment proteins is referring to the hands on the virus. So when you see attachment proteins, these are the ligands on the virus. The adhesins, and that's what adhesins, those are the hands on the bacterial cell. That's the only difference. They're both hands, it's just different terminology. One is talking about viral hands or viral ligands. This one is talking about bacterial ligands. Got it? And if you take away the viruses or bacterial ability to make their hands, guess what? They become avirulent. So what does that word avirulent mean? In other words, if you take away the viral ability or the bacteria's ability to make their hands, right, they can't make their hands anymore, you make them avirulent. Now what does avirulent mean?
Harmless.
Yeah, not virulent, so they're harmless, they're non-pathogenic, they can't take root in you, and they cannot potentially make you sick. That's a good thing. Now, some bacterial pathogens, they bypass those ligands. They bypass the hands. What they do is they form biofilms, yes. Now, haven't we talked about biofilms before?
Yeah.
They use biofilms to stick to each other and to stick to you, makes sense? So they bypass hands altogether. They just use a biofilm to make you sick. Now, an example of a biofilm is right here. So basically, dental plaque is basically a bacterial biofilm with lactobacillus in there and all other guys in there. Now, why do you want to go to a dentist and get this plaque removed from your teeth?
So your teeth don't get messed up.
Yeah, so you don't get periodontal disease, you don't get gingivitis, you don't get cavities, all the above, right? These are all diseases. These are basically infections, makes sense? Everything you just listed, gingivitis, right? Periodontal disease, cavities, these are infections. By these guys, okay? They're growing on your teeth. Basically, when you eat food, right? They eat the food, okay? What they're doing is, for example, for dental caries or cavities, they eat the food, they produce acids, those acids wear away your enamel, that's how you get a cavity. So this is why you should go get the plaque removed as often as you can, every 6 months. Hit a can.
Does tuberculosis form a biofilm on your respiratory system? Is that how that works?
No,
Okay.
it takes a root within your lungs. It does not
Right.
make a biofilm.
Okay, because you can see it in x-rays and stuff?
Yeah.
I was just, okay.
It's not a biofilm. You're just looking at the cells growing
Okay.
in your chest, in
Thank
your
you.
lungs. Okay. So these guys, they're not making hands. They're just sticking together, right? On your teeth. That's a plaque, basically. Okie dokie. So the nature of infectious disease. Okay. Now, infection is basically what? You've got invaded with a pathogen. I said infection is where the pathogen has now taken up root in your body. It's now growing in your body. It doesn't always lead to disease. It can, it may not. But infection just means you have pathogen in you or on you. It is actively growing. It's actively colonizing you. Now, this term here, okay, disease, basically means when this pathogen alters normal body functions. As long as your body functions are normal, you are not diseased. Makes sense? But as soon as that pathogen starts doing something crazy, like gingivitis, right, or periodontal disease, all the above, your body functions are abnormal, that is dis-ease, make sense? Dis-ease, abnormality. Now, disease is also referred to as morbidity. That you should understand, okay? Because you know what mortality is, but you also know what morbidity is. Morbidity is just disease. Got it? Mortality is what? Death. But morbidity is actually having a disease. Now let's talk about the manifestation of disease. Talk about symptoms, signs, and syndromes, and how do we know the difference between the three? All right. It's real easy. Symptoms are very subjective. We cannot measure a symptom, right? Symptom is what the patient feels, right? But no one else can measure that. What are symptoms? Headache, right? Chills, malaise, things that aren't measurable on the outside. It's basically what you feel. Normally you give a scale of 1 to 10. How bad's your headache? I say it's a 10. Someone else may have the same exact headache, say it's a 5, okay? So symptoms are what you feel as a result of disease, right? Disease, but they are subjective. And what does subjective even mean? When I say the word subjective, what does that even mean?
Different opinions.
What's
It
that?
differs from bias.
Okay, so it differs from person to person, makes sense? In other words, we can't really measure it. So think of it that way. As long as it differs from person to person, it's very subjective. Those are symptoms. Now, symptoms are very different from signs of disease. Now, signs are what? Objective, because these are things that you can actually see, you can measure. You can measure a fever, right? That's objective. That's a sign of disease, okay? If you have a rash, we can see that, right? Okay, if you have swelling, for example, we can see that, correct? So anything that you can actually see, these are what? Signs of disease. So normally the healthcare practitioner, right, they look at you to look for what? Signs. Like an elevated heart rate, for example, right? These are all signs of disease. Now what's a syndrome? What's a syndrome? A syndrome is a collection of symptoms and signs that characterize a particular disease. So let's talk about HIV, for example. So what are the typical symptoms and signs of disease that are really with HIV, okay? Loss of appetite, loss of weight, okay? Malice, or basically tired all the time. Down the line, right, you just start getting all of these opportunistic infections that normal people don't get. So all of these are basically symptoms and signs of what? A syndrome, HIV. And normally, the symptoms and signs that compose a syndrome, you find that with that particular disease. So all the things I just mentioned, you find that with typically what? HIV. Now, asymptomatic, which means what? No symptoms, or subclinical, means the same thing as asymptomatic, no symptoms. These infections lack symptoms, but you may still have signs of infection. So sometimes doctors, what? They pull your blood, right? They can see if you have an infection. They can look at elevated white blood cell counts. In other words, when you do a urine analysis, you can look for elevated white blood cells in the urine. It's a clear sign of what? Infection. What's the whole point of your white blood cells? Right, to fight infections, right? So if you have an elevated number of them in the blood or in the urine, it's probably a telltale sign that you're trying to fight off something, makes sense? So even if you're not having symptoms, we can still check for signs of disease. Okay, this table just quickly summarizes what? Symptoms, right? Things that only you feel, versus signs, things that we can actually look for. These are things you will be looking for in your patients, right? You're looking for what? Signs. You can only ask your patient about their symptoms. It's all relative, right? This is what you're looking for. How do you know they are actually sick? They's like, oh boy. Okie dokie. Terminology of disease. You should be I'm not going to test you on this, but keep in mind, not everything you learn will be tested, but it's good to know anyway, right? It's good to have knowledge. So real quick, what do some of these things mean? I'm going to go through all of it. Bless you, look at the easy ones. When you hear carcinoma, right? And carcinoma, that's talking about cancer, right? That's real simple, right? Real quick. Colon. That's how E. coli got its name, right? Escherichia coli came from that cold. It means it's found in the gut. Okay. You know, dermato means skin, endo, inside. You know, hepa means liver. This is stuff you already know, okay? Osis, condition of ulma, tumor or swelling, itis, inflammation, you knew that already, right? Idio, unknown. You knew this, real quick. What else, anything else? Teratogen, defect, so a teratogenic substance causes birth defects. Toxins means what, a poison, so toxins are what poisons. I'm gonna test you on that, no, but you may see this. You should know what they mean. You don't wanna go to work and someone says something osis, you don't know what they're talking about, right? You don't wanna look like that, no, okay? Osis is condition of, okay? Itis, inflammation of. Oh boy, now what does this word mean? Etiology. Etiology is finding the cause of some disease. Now, of course, not every disease is caused by a pathogen, right? That's what we care about in this class, but there's other diseases that are hereditary, which means you inherited that disease, or congenital, meaning you had it from birth. We're just concerned about infectious diseases. Now, in this case, we're talking about the germ theory of disease. We're talking about Robert Koch. We care about infectious diseases, right? Infectious, meaning caused by a pathogen. That's what we care about. Now, I'm not going to spend too much time on Koch's postulates. You know why? Because we talked about that, I believe, in chapter 1, makes sense. But what I will spend time on some exceptions to Koch's postulates. In other words, why doesn't it always work 100% of the time? I will spend time on that.
What's pathology?
Pathology is when you're looking at tissue, for example. You're looking at tissue and you're trying to find the cause of disease in the tissue.
Okay.
What we do? I'm not going to talk about categories, because I just mentioned to you before, you've got different categories of diseases, so let's skip that. Okey-dokey. You know all about this, right? That's Koch's postulates. What? Step 1, okay? All these guys should have similar symptoms, right? Okay? You have to isolate the bacteria from these guys. You need to grow them outside of the host. You need to grow them up, right? You need to take these guys and get them into a poor mouse that's not sick, right? And that poor mouse should have the same disease as these poor guys did, right? Unfortunately, and in fact, he does die. He croaks. It is messed up. And of course, a part of those postulates, the bacterium should not be found in healthy organisms. Okay, so you know all about that. But what I want to spend time on are the exceptions to this, right? Why doesn't it work all the time? Here are your exceptions. Some pathogens cannot be cultured outside the lab. This is one of the key points of what Koch's postulates. You can't culture everybody outside the lab. For example, Microbiology leprae, which causes leprosy, we can't culture it outside of the host. Can't do it. And you can grow it in armadillos, but you have to grow it outside of the armadillo, and that we just can't do right now. So how do you prove, for example, that Mycobacterium leprae causes leprosy? You can't do it by those postulates, right? You can't do it that way. All right? Some diseases are caused by a combination of pathogens, or they're affected by other cofactors. So let's say your immune system is compromised. Think about it that way. Your immune system is compromised, and that allows some bacteria to make you sick. The pathogen requires a human host. Now, it is not ethical, correct, to purposely give a person some infection just to prove Koch's postulate, right?
Of course, that didn't stop people years ago.
Yeah, I know, back in the days they did, but nowadays we don't do that anymore. Okay, we don't do that anymore. So if it's a human host, we can't do Koch's postulates. Also, some diseases are caused by more than one pathogen. If you talk about meningitis, for example, there's lots of bacteria. Not just Neisseria meningitis, that's just one of them, okay? That's one bacterium that can cause meningitis. That's not the only one, right? Or pneumonia. There's lots of bacteria or even viruses that can cause pneumonia, so some diseases just have multiple causes. In other words, different pathogens cause the same disease. Make sense? That's the problem. And some pathogens are just simply ignored as a potential cause of disease. So back in the day, people thought that if you had an ulcer, for example, you were just stressed out, basically. That was it. Well, most ulcers are caused by a bacterium. Helicobacter pylori. In other words, if you get that ulcer culture, you'll find out it's just a bacterial infection. Just take some antibiotics, It clears up the infection, and over time, right, over time, it also will heal itself. Okay, we'll probably stop here.
Perfect.
Now, what is this whole concept of a virulence factor? Okay, a virulence factor is just some factor that allows the microorganisms to cause disease. It's called a virulence factor. In other words, pathogens, if you're a pathogen, you have to have at least one virulence factor, right? Because non-pathogens, guess what? They don't have any virulence factors. It's just whatever they have to allow them to make you sick, essentially. Now, this concept of pathogenicity, it goes along with virulence factor. It's just that microbe can get you sick. Now, under virulence, there's different degrees of pathogenicity. You can talk, for example, basically, you just got off a virus, for example, right? And you learn that viruses are very specific to their host, okay? So you probably heard Tuesday about the tobacco mosaic virus, right? That ring a bell? Okay, well, guess what? The tobacco mosaic virus, okay, it's pathogenic for plants, right? Not for humans. So if you're a human, you don't have to worry about tobacco mosaic virus, right? If you're a plant, you have something to worry about. So this is what I mean about degrees of pathogenicity, like specific hosts, for example. Here are some of the virulence factors. We'll talk about them on Tuesday, okay? Adhesion factors, basically factors that allow what? The organism to attach to you.
Bacteria.
Like bacteria or even worms, right? Viruses.
I thought we said a while ago. adhesion.
Well, adhesives, okay? Adhesives, not adhesion factors.
Okay.
That's a different word. Adhesive would be the adhesion factor on bacteria. I'm talking about adhesion factors, not adhesin. Difference, I-N. Got it? That's the difference here. All right? Biofilms allow bacteria to attach to you. Extracellular enzymes. So extra means what? Outside. So these are enzymes that the bacteria make on the inside of them. And then they secrete them outside to cause illness. Toxins, okay, these are basically poisons, make you sick. And also anti-phagocytic factors, in other words, your white blood cells typically would what? Eat bacterial cells, that's phagocytosis. Well, some bacteria kind of evade that whole process.
Yeah.
See, they don't. So on Tuesday, we will finish chapter 14. Your chapter 13 quiz will open tonight. I'll give you the whole weekend to work on chapter 13 quiz.